How you doing?
Fine.
Robert Wyndham has regular appointments with vascular surgeon Dr. William Schutz several months after treatment for DVT.
DVT stands for deep vein thrombosis. Thrombosis meaning a clot, and deep vein meaning it occurs in the large veins which are deep within the legs and the muscles of the thigh and calf. Well, do you mind if I take a look at your legs and see how we're doing?
Mr. Wyndham had a very large blood clot, most likely the result of cancer treatment.
Swelling of the leg and painful pain in the leg.
The color looks pretty good.
The pain caused him to limp, which then led to back problems and a visit to an orthopedic doctor.
They just happened to do a CT scan of my pelvic area, and it showed that I had some possible clots in there. And of course I said, well, how serious is that? And radiologist says, well, it could be fatal.
Any pain or discomfort when I do that?
The greatest danger from DVT is a pulmonary embolism, which is caused by clots traveling to the lungs.
He had a very extensive clot, and it went all the way up into his lower abdomen and extended all the way down to his knee.
In addition to cancer, other risk factors for DVT include a broken leg or hip, trauma requiring hospitalization, major surgery in the abdomen, pelvis, chest, hips, or knees, prolonged immobility, either in the hospital or from a long car trip or airplane ride, and a family history of blood clotting abnormalities. Other risk factors include obesity, history of heart attack, stroke, or congestive heart failure, inflammatory bowel disease, pregnancy, nursing, or using birth control pills.
Surprisingly, many DVTs can be silent and don't have any symptoms. So it's just important to know whether you have an increased chance of a DVT, and then to be aware of the subtle signs such as pain in the calf or swelling that's new and unusual. Occasionally people that have a DVT will also have some of that clot move to their lungs, so they'll have some chest pain or shortness of breath.
Vascular surgeons use duplex ultrasound or venogram to confirm DVT. Doctors often recommend their DVT patients wear compression stockings, which prevents blood from pooling in veins. In rare cases, patients may need a surgical procedure called venous thrombectomy to remove a clot. More often, treatment of DVT begins with injections of a blood thinner to keep the blood from clotting, followed by oral medications. If the clot needs to be dissolved, the vascular specialist may use thrombolysis.
We'll put some tubes in the veins and infuse slowly over a period of a day or two blood clot dissolvers and actually just dissolve the clot. Well, things just look dramatically better.
Mr. Wyndham is doing well, but is keeping close track of any symptoms.
If I have swelling or if I have pain, that's just a red light signal for me to call the doctor immediately. But I've already been told to resume normal activity, which is a real good feeling.
Ask your doctor about your risks for vascular disease. Visit vascularweb.org to find a vascular specialist and learn more about vascular wellness.